Hi, my name is Dr. Ryan Saldivar, Doctor of Chiropractic, personal trainer, yoga instructor. A few years ago, Joe Rogan made some comments about chiropractic, and today we're going to watch some of those clips, piece apart what he said, talk about some of it that may be true, some not, because he made some good points. Let's watch some of the clips and then we'll get into it.
I'm pretty cautious about sitting up straight, but from back injuries, I've been very, very cautious about working out all the muscles around my back, which I just worked out and I figured those things would take care of themselves.
Another important thing that Mr. Rogan says in this section of the video is that at this time he was afraid to work out those sections of his spine. So if he had pain at the base of the neck, he might have avoided rows or things that activated the upper trapezius because that might have at that time irritated the disc issue that he had. It's really important to strengthen the muscles of your spine because it's the muscles that go along the spinal column that give support to the spinal column, as well as the core muscles. And by the core, I mean everything that surrounds the musculature of the rib cage, the spine, the upper back, the shoulders, the lats, and even the glutes. In this section, I would consider that to be the core because it's helping you to have a tall posture. And so it is important to strengthen those muscles that come along your spine, your lats, your erector spinae, the multifidus, because that's what helps you to elongate your spine in a tall posture. If you imagine, an analogy commonly used is if I were to hold a bowling ball, which the head weighs about the same as a lot of bowling balls, and I were to hold that right here, I would have a pretty easy time holding it there for as long as I wanted to. But the further I extend that bowling ball forward, holding it with my arm, it's going to take a lot more strength to support that. And that's the same way it is with the head, that the further it comes forward, now we're getting away from being stacked up in a proper way. And so all these muscles are going to have to work a lot harder. It is the best thing to be under chiropractic care so that you can maintain a straight posture, because the more the body hunches forward like this, there's a lot of research that shows that further compresses the disc and then makes it degenerate earlier in life. So this is one thing to already look at and start to study more and look into the research associated with these things.
Treat them as like just like brushing my teeth, like my spinal column and all those supporting muscles in the spine. Those are huge. They need to be exercised.
Okay, so now we're getting a little bit later in the video where he's saying that he does now exercise the muscles that surround his spine because over time he realized it's just like brushing his teeth, that he has to strengthen those muscles along the spinal column because it takes regular care and it's really important. And he says it's just like brushing the teeth. So this analogy is something that I use really commonly with my patients, is that we have to have what I call spinal hygiene. It's like daily care of stretching the neck to the sides, doing gentle twists to the thoracic spine, not the lower back, but the thoracic, the rib cage, reaching up overhead and side bending, not to push your chin with any velocity trying to pop it, but to gently stretch the sides, to look up, to look down, rotate without any velocity. These kind of things I consider spinal hygiene, just like strengthening the core, strengthening the hips. And I use this analogy of brushing the teeth in the same way with chiropractic care, because chiropractic care is not like a one and done thing where you get adjusted and now you should feel better. This is the way that a lot of people misuse chiropractic, is they wait till they're in a ton of pain and then they come in and they're hoping that a couple adjustments are going to help them. Getting adjusted should be looked at much like brushing the teeth, in that it is a part of the lifestyle. It relieves the inflammation. And to understand that the cracking sound that you hear, we call it cavitation, because the cavitation is the scientific word for an air bubble exploding open. And what happens when there's segments of the spine, the joints look just like this, and they're not moving, is that inflammatory gases get stuck in those sections of the spine. And then when we move the section quickly, pushing the spine from posterior towards the back, towards anterior, towards the front, this then breaks those gas bubbles open, which are by nature inflammatory. It releases the inflammatory gases, and it's the breaking open of those air bubbles that makes the cracking sound, or the cavitation. And so this is a healthy thing. It's got nothing to do with the bones. It doesn't mean you're taking a bone that's out of socket and putting it in socket. You're simply making the adjustment to explode those inflammatory gases out of the joints of the spine, so that as the inflammation goes down, the sensation of pain goes down, the movement restores, because you should be able to bend your head evenly to the left and to the right. If you look into the mirror and you lean to the left and you can only go this far, and then to the right you can lean this far, then that means there's a vertebral section right there, which instead of stacking up evenly like this, it's tilted in this way. And that can come from people sleeping on a pillow on their side and their head's a little bit too lean forward to the side. And then with time, the vertebra slides that way and develops a lateral tilt, a tilt to the right. So then when they want to tilt to the left, they end up having to go further because now the section's here. So their neck wants to relax like this. And then as they go straight, now it's just coming this way. And then they try to go left and it can't go so far. And so this is one of the ways that people can tell they need to be adjusted. But simply adjusting it one time, it's not going to permanently correct it because the ligaments that go vertebra to vertebra, they are conditioned to be a specific length that holds the spinal column in that tilt chronically. And so then the more frequently people get adjusted, the longer that adjustment holds. And so in this way, chiropractic care is also a lot like brushing the teeth in that it takes regular care. There's a certain point when people are trying to get out of pain where they might need to be adjusted more regularly. And then once they are free from pain and their mobility is restored even on both sides, then they can start to space out the adjustments more like once a week, every 2 weeks. After 3 weeks, the ligaments are definitely going to be pulling it back into place. So I like to see my patients every 2 weeks on a regular basis because I notice that by that time, when we're on a maintenance schedule, the ligaments are starting to pull it back to where it was. But the longer they undergo chiropractic care, the more the ligaments on each side, as they come down from section to section, they start to become at the length as they adapt to that better alignment. And then from that, the ligaments start to maintain the adjustment. And so in this way, being adjusted is also like brushing the teeth. But me and a lot of my chiropractic colleagues, we call regular stretching and exercising. It's also like spinal hygiene. It's the daily self-care that it takes to maintain a healthy spinal column for the longevity of your lifespan.
Yeah. Makes sense. Because sciatica is a disc that's bulging, meaning the disc, the soft tissue in between the two hard bones is pushing out and it's pressing up against the nerve. And it causes pain that shoots down your ass and your lower legs. And a lot of people don't even recognize it as a lower back issue because of
Okay, so for the purpose of staying scientific, we're going to call these things hips in here. And so sciatica is not always from a herniated disc. And so here is a model of the spine. And so this is the lumbar spine. We number them L1, L2, L3, L4, L5. And then from here, L5, L4, L3, L2, L1. So these are the lumbar vertebra. This is the sacrum. And then these vertebra of the sacrum are fused when we're born, but we still call them S1, S2, S3 because before we're born or for the first year or two of life, they have a little disc in there and then over years those bones fuse together. So this is the back of the spine. These are the parts that you can feel. They're called the spinous process. These are the ilium. This is the sacrum. And so we call this the sacroiliac joint. And these little orange parts that come out of every segment, these are a visualization of the nerves. So you can see if somebody were standing, you get a side view of the lower back this way, then each spine here, these are the intervertebral discs. And so when a person has a chronic lower back issue, the ligaments that connect from transverse process to transverse process, the muscles and the tendons that come in through here and holding each vertebra together, they can reach a certain amount of inflammation that it can at some point trigger a nerve pain. Within that level of inflammation, the disc can also be inflamed and it can herniate out to the side from this direction. And you can see how the nerve lives right there, right next to the disc. And so if this disc were to slide out that way to the side, that would be a herniated disc, and that could compress one of the nerves here. Now, sciatica is when any of these nerves from L4 to S2 are compressed, then that can shoot down different parts of the leg or the side of the foot or to the big toe. And so it can be from a herniated disc. Joe Rogan is right about this. But it can also be due to a condition called spinal stenosis, which this is the intervertebral foramen, this little space here where the nerve comes out in between each vertebral segment. And one process of arthritis is when the disc degenerates and then the person builds up calcification in the intervertebral foramen, and that's called spinal stenosis. And so then that condition of spinal stenosis can also irritate or compress on the sciatic nerve or branches of the sciatic nerve. That can also cause sciatica. There's also a condition called piriformis syndrome. So the piriformis is a muscle that comes from the lateral aspects here of the ilium, and then it comes down this way and it connects to a piece called of the femur, the big leg bone called the greater trochanter. And the piriformis comes The right over here through the side of the hip, it's a very well-known muscle when it comes to sciatica, because the sciatic nerves, as it comes through, goes either under, over, or in some rare cases through the muscle belly of the piriformis muscle. And so when the piriformis becomes tight enough or imbalanced enough, it can also compress on the sciatic nerve, which is a condition called piriformis syndrome. This can sometimes be a precursor to sciatica, or it can be a cause of sciatica. Okay, so now we're going to get into the part where Joe Rogan says some things about chiropractic that he made a few chiropractors pretty upset because he doesn't so much agree with the profession. But he also shares some really important things about experiences that he had at chiropractor office, one in particular. And I think it's really important for us to respect his point of view, because everybody is entitled to their own point of view. And also it is very unfortunate that he saw this chiropractor for over a year and he did not have a good experience, and in the end he did not feel that the chiropractor helped him. So that's the important thing that I really want to respect. And also it is important that we all respect everybody's point of view, because each of our point of view is limited by our perception and our comprehension of things. We understand things according to how well we know them. Sometimes people can have a bad experience with one practitioner. I've had several medical doctors that I did not appreciate their point of view. And I've also had other medical doctors that were just incredible and really helped me to change my life. So let's break this part down one segment at a time, and we'll get into it here.
I had a similar issue with my neck where it was pushing on my ulnar nerve, and I was getting this elbow pain, and I was like, fuck, this really hurts.
And so for those that don't know, a herniated disc in the neck, when it's inflamed, it can be a very painful condition. It can be debilitating. It can hurt so much that the person doesn't even feel comfortable getting out of bed. Just even being upright and putting the weight of the head on that inflamed disc, it can create so much nerve pressure that you just have to go lie down. It can be the worst pain in the world.
Like down my arm and in the back of my tricep, and then I started getting numbness in my fingers, and that's when I started figuring out what was going on. Then I went to a doctor. I went to a chiropractor first, which is a fucking giant mistake. I spent a year.
But do you not believe in chiropractors?
I don't believe in chiropractors at all. I think it's 98% horseshit.
Okay, so that was a little rude, but as I said, the man's entitled to his own opinion. It is, it's a very disappointing thing when somebody has really intense pain and they go to somebody what they consider to be a specialist in their field, and they don't get the relief that they're looking for. So I respect Joe Rogan for his opinion, and at the same time, I had a different experience. So when I was 16 on the verge of turning 17, I used to surf a lot, and I was surfing down in Santa Cruz at a famous place called Steamer Lane. And the waves were abnormally big that day. There was a storm coming in, and so the waves were really big. They were 15 feet around, more or less. And I was a pretty good surfer, but not anywhere near a professional surfer. So it was my first time surfing with that big of waves. And it was also my first time surfing at that location. And so what happened was, when I was dropping in on a wave, the wave is coming up like this, and I was dropping in, I leaned too far forward and the nose of my board got stuck in the water and I fell in. And so when the wave was at its biggest, most powerful place, it rolled me along and I hit some rocks on my back, and I ended up fracturing 5 vertebrae in my spine. And so when I went to the medical doctor, they did x-rays and said that the extent of the damage was really bad. And what they recommended was 5 spinal surgeries. And so this for me was extremely traumatic injury. I had so many discs in my neck and in my lower back that were herniated from that injury. And I had to go to 5 different chiropractors before I found the one that could really help me. And so as much as I understand Joe Rogan's experience, I had a similar experience. If I had gone to the first chiropractor and never gone back to the second, third, fourth, or fifth one, I might have felt the same way that he feels about chiropractors. But I tried another and another and another. And what I found was every chiropractor had a slightly different style and a slightly different way of working with the spine. Some incorporated massage techniques, some used ice packs and hot compresses, some used lasers, and some had some very specific ways of adjusting the spine that could help me more than others. Okay, so one thing that's important to remember is that in the United States of America, there are over 70,000 chiropractic professionals practicing at this time. Now, if none of them were helping anybody and what they do was total BS, they wouldn't be able to have people coming back because they wouldn't be receiving any benefit. And so out of these more than 70,000 practitioners, there are over 200 registered chiropractic techniques that exist within the field of chiropractic. So even if I were to see 1, 2, 3, 4, 5 chiropractors, I could have a very different experience in each office depending on which technique they use. I don't need somebody that has their posture like this to tell me that they don't believe in chiropractic, because if somebody's neck is like this, I already know they don't believe in chiropractic because if they were having those segments adjusted, they'd be able to get their neck up straight. Because when somebody has a herniated disc in their neck, they lean forward to alleviate the pain and the pressure from those areas. For example, just out of the vast difference of chiropractic techniques, there are low force techniques, meaning a very gentle force is put in to adjust the spine. There are no force techniques, such as network chiropractic. And there's what's known as high velocity, low amplitude adjusting, which is things like diversified and Gonstead adjusting. There's also chiropractors that only adjust the upper 2 vertebrae of the neck. They're called upper cervical spine specialists. And then there are several others. There's one called the Cox flexion distraction technique, where the patient lies on a table and then the lower piece of the table hinges down like this, and it pulls the vertebra apart in the lower back and gives a traction, and then it relieves the traction, pulls the traction, relieves the traction. I have one of these tables in my clinic, and it gives an incredible amount of relief to patients that have a herniated disc in their lower back. And so if a patient went to a chiropractic clinic that did not have that one particular type of table, and then went to my office, they would have two completely different ideas of what chiropractic does and what chiropractic is, just from those two examples alone. There's another technique that one day saved my life. It's called chiropractic biophysics, or referred to as CBP. And this is a very in-depth treatment style where they take an x-ray of the entire vertebral column, and then they measure the curvature of each segment of the neck. So let's say for the neck, this curve is supposed to be in there. It's called a lordotic curve. For the thoracic spine, there's supposed to be a curve coming this way called the kyphotic curve. And then in the lumbar spine, in the lower back, it's supposed to also have that lordotic curve in there. So in chiropractic biophysics, they measure each vertebra and which particular angle that curvature is coming up. And then they develop a care plan, very in-depth care plan, where they put you on these treatment tables that put pressure on each segment specifically to restore that curve to the ideal curve it's supposed to be at. Now, if Joe Rogan had found a chiropractic biophysics practitioner, he would have had a completely different experience than if he had just gone to it. It sounds like he went to a diversified chiropractor, which is the most common type of chiropractic, where the adjustment is done and that's it. Now let's go and follow a little bit more, because he talks about his experience getting treatment by some chiropractor where there was some massage and some cold laser. So let's hear that part.
Shit. That's what I think. And I don't know, but I think chiropractors that are smart, they incorporate things that I think are beneficial. Cold laser, massage, a lot of different things. But I think that manipulation that they do, unless you have like some sort of significant scoliosis or something they're attempting to slowly put back into position, I think most of the time it's just popping your neck and it just feels good.
Okay, so this part made me happy because I am one of the chiropractors that incorporates massage into my adjusting. A lot of chiropractors don't. Massage is not a chiropractic technique. They don't teach it in chiropractic school. Massage takes 1 year to get this certification. And chiropractic, I was in college for 12 years. It's a post-bachelor doctor degree. And so chiropractors are doctors. I know a lot of people say chiropractors aren't real doctors. That's fine. They also like to say dentists aren't real doctors. That's fine, but it is a doctorate. And it took me 12 years to complete that amount of college versus 1 year to get my massage certification. But I practiced massage for 20 years. And the difference is that a lot of people do massage for only a couple years, because after a few years, their back, their hands, their shoulders, their neck, it starts to hurt so much that they eventually go into a different profession. And it's only the massage therapists that study massage for 5, 7 years or more that take all of the advanced courses in anatomy to really understand how to help people with spinal pain, especially advanced cases like herniated discs and sciatica. So I did massage for 20 years before I became a chiropractor, and I now infuse those techniques into my chiropractic techniques. So my sessions are 20 minutes, 40 minutes, 60 minutes, or 80 minutes, and that depends on how much body work people want infused into the session. I also do a technique called shockwave, which is just incredible. It's in the field of regenerative medicine. I'll do another video on that soon. But some of the highlights of the shockwave technique is its ability to break up scar tissue, strengthen the ligaments, and speed up the healing of torn muscles, torn tendons, and ligaments. And this has an incredible benefit when it comes to stopping spasms, reducing chronic pain, and helping the spine to hold its alignment better. It also helps with arthritic conditions like hip arthritis, carpal tunnel, rotator cuff tears, Achilles tendon tears, hamstring tears, things that just don't seem to heal over a long period of time. We can shockwave them, and that really improves the ability for that muscle to have less scar tissue, speed up the process of healing, and this also has a process of supporting the spine in the long run because the spine is held up by all the musculature that supports it. So all of these adjunctive therapies do also have an incredible benefit when you add them to the chiropractic techniques. So thanks, Joe Rogan. I am one of the smart ones. And it's nice to hear him say that it does feel good. The neck adjustment does feel good. Okay, let's move on to the next segment and then we'll wrap this up.
But I just,
Like in an immediate sense.
I went to a guy that's a very nice guy, and he was trying to tell me that I didn't have a bulging disc because he was pushing down on the top of my head, and it didn't hurt. I'm like, okay. So I was listening to him. I listened to this guy for like a fucking year. I had treatment with him, and I still had these neck problems and back problems. Then finally I got an MRI, and they're like, yeah, you got a bulging disc. And I remember being angry.
Okay, so in this part, Joe Rogan's talking about he went to a chiropractor, and the chiropractor did what's called an orthopedic exam. It's called the cervical compression test, when you press down from top to bottom on the spine. And it's a test that we do to check for radicular pain or nerve pain coming down the limb, which can be a sign of a herniated disc. There's another maneuver called the Valsalva maneuver, where you have them breathe in, and then you bear down, you squeeze like you're going to the restroom or coughing or sneezing, like that. And this Valsalva maneuver is another way that we can test for herniated disc because that increased internal pressure, it can also add compression to the nerve, which shoots down the limb. This is also the case when people have a bad herniated disc, when they cough or sneeze and it really, really hurts in that area. That's another sign that it could be a herniated disc. But the only real way to diagnose a herniated disc is an MRI. It's also important to note that we have to be flexible in our orthopedic exams according to the person that's in front of us. So Joe Rogan is a jiu-jitsu practitioner. He has a lot of muscle around his neck. It's almost like he almost is like, it's like he adjusted his neck. It's like, Joe, what neck? You know, his neck is like that big right here. He's got so much muscle around his neck. And so for him, all the years of doing jiu-jitsu, of having guys put him in guillotines and rear naked chokes and triangle chokes, he's used to having a lot of pressure on his neck. And all that musculature there is reinforcing the structure of his neck to the point where this chiropractor is pressing down, probably not nearly as hard as these jiu-jitsu guys are wringing his neck and asking, does that hurt? And he's like, no, it doesn't hurt. And so this chiropractor said, well, that means you don't have a herniated disc. You need to be flexible when you do these orthopedic exams to look at the person in front of you. If a person has a very thin neck without a lot of musculature on it and a herniated disc and it's inflamed at the time, and you do the cervical compression test, then it's going to hurt a lot. And then another one is called the Jackson's test, where you have them laterally flex and you press down. That puts even more pressure on that side if the disc is herniated on that side. There's another one called the cervical rotation test, where they rotate and we press down. And so all these ways we can narrow it down a little bit. But again, the only way to know for sure is through an MRI. Another thing that he says in this segment is that he felt really angry at this point because he had already been receiving care from this chiropractor for 1 year. We don't know how much that he spent on treatments, but possibly in the thousands if the doctor was having him come in multiple times a week. And so that level of frustration under the care that he got, in my opinion, he has all the right to say what he said about the chiropractic profession because he had a really negative experience. And so I really want to honor that as well. I want to share here to wrap this up is just that, you know, within the 70,000 practitioners in America, we are all very different. I went to Life West Chiropractor College in Hayward, California, It was rated #1 in the world several times. And that's because of the level of education that we got, the variety of techniques that we were taught, and the level of academia rigor that they had there. I've had experiences with chiropractors that didn't help me at all. And I've had experiences with chiropractors that were absolutely life-changing. I'm grateful for this profession. I've already been able to help over 20,000 people in my career. And it's my goal before I retire to help over 100,000 people. Being able to go to work every day and see people progressively get better and returning to doing the things that they love, it gives me immense joy and gratitude that I'm able to work within this profession. And I would never say eat a taco at a taco stand in Winnipeg and then say, oh, all Mexican food is horrible. I would never meet one person of a certain ethnicity and then think everybody from that country is absolutely terrible. I would never go to one type of clothing store and then say, oh, all clothes are total bullcrap. I didn't find anything there that I like. So I understand Joe Rogan's frustration because he did have a very negative experience paying a doctor thousands of dollars, going there several times over a year, getting a misdiagnosis. But at the same time, that doesn't mean that all chiropractors are like the one that he went to. Had he gone to a chiropractic biophysics doctor that could have restored the cervical curve in his neck, he could have had tremendous relief from that herniated disc. There was a time when I was having shearing pain in my neck. I got adjusted by several different chiropractors. This was maybe 12 years ago, and one of the experiences that led me to become a chiropractor. I went to a few different chiropractors in San Francisco, some of the best ones with the best reviews. I got no relief. I went to some of the best massage therapists I could find. I had no relief. And then I found a chiropractic biophysics doctor who x-rayed my spine, showed me that my neck wasn't only losing the cervical curvature it's supposed to have, but it was actually reverse curving, so my head was coming forward. And this is because of decades of teaching vinyasa yoga, so it was giving me the Superman chest, which then made my head come this way. And so the doctor had to put me on these tables, strap me on and push my chest back, push the curvature into my neck, restore the curvature in my spine. It took 3 months of regular treatments, and my neck still has not hurt since as much as it did before that series of treatments. So the chiropractic biophysics is absolutely life-changing. It's something that could have helped Joe Rogan at that phase tremendously, and it's something that is really worth studying. One day I wish to incorporate it into my practice when I have a little bit more room. So for me, after teaching vinyasa for many years, I had this kind of posture. I had a very straight thoracic spine. So if you saw me straight on, it wouldn't look like I was sitting like this, but with my chest coming forward so much, once we pulled the chest back to where it's supposed to be, it showed that I had a very straight neck. And that was also from doing a decade of jiu-jitsu. So a lot of times when you get into put all of these choke holds, it starts to straighten your neck out a little bit. And it's something that receiving chiropractic care can really help with. Anyway, I want to thank Joe Rogan for his transparency. It really is a lot of vulnerability sharing your experiences with a doctor. And it's something that the doctor himself or herself wouldn't be able to share. So it's really good that we have access to this information. I'll make other videos sharing some of the stories of some of the patients that I've helped as well. And I'll go into detail of some of the massage modalities, the shockwave treatments that I do, the chiropractic techniques that I do, and I'll share in more detail about the injury that I had when I was surfing and I broke my back in 5 places and the process of healing that I went through. I had to study multiple forms of exercise, develop my own sequences of yoga and weightlifting to help myself to recover. And I'll share those in detail as well because I've also taught tens of thousands of hours of fitness classes and helped many people recover through exercise to overcome back pain as well. So again, my name is Dr. M. Ryan Saldivar. That's going to be it for today. Thank you so much for watching, and I hope you all have a great day.